Hi, my name is Jacqueline Chestnut. You can follow me on Instagram at iam.nursejackie. The principles of pharmacology include pharmacokinetics, pharmacodynamics, and pharmacogenetics. Today I will spend time discussing pharmacokinetics and pharmacodynamics. Pharmacokinetics describes how a drug moves throughout the body. This is done with absorption, metabolism, distribution, and excretion. Absorption is the movement of the drug into the circulatory system. The drug can be absorbed or transported through the active diffusion, passive diffusion, or penocytosis. Penicillin moves through the circulatory system via active transport. Macromolecules such as insulin or drugs made with large proteins access the circulatory system via penocytosis, but most drugs rely on passive diffusion to be absorbed. Routes of administration include oral administration, IV administration, sublingual, transdermal, rectal administration, pulmonary administration, as well as topical administration. Here I have different routes of absorption and the speed of how fast they are absorbed into the circulatory system. Oral administration is preferred. It is safe, inexpensive, and the most convenient. Pills must disintegrate into smaller particles, dissolve, and then pass across the cell membranes in the GI tract first before it is absorbed into the circulatory system. So when you look at the oral formulations on this slide, the capsules, tablets, and especially the enteric-coated tablets are down at the slowest. They must first be disintegrated before they are absorbed. IV administration routes bypass the GI tract, allowing for a more rapid, extensive, and predictable drug absorption. With sub-Q or IM administration, the drug is absorbed via simple diffusion. IV administration is absorbed directly into the circulatory system, allowing for 100% of bioavailability. Bioavailability indicates the proportion of a drug that reaches its intended site of action when administered. As mentioned earlier, the IV route has 100% bioavailability, and drugs administered orally, the bioavailability ranges depending on either incomplete absorption or first-pass metabolism. In first-pass metabolism, the drug undergoes extensive biotransformation before reaching the circulatory system, thereby decreasing the bioavailability of the drug. For example, through oral administration, the drug must go through the GI tract, the portal vein, the liver, before passing into general circulation. Examples of drugs that go through this are propranolol, lidocaine, and estrogen. As I said, bioavailability can also be affected by incomplete absorption. Other things that affect absorption would be the chemical characteristics of the drug, such as if the pill is enteric-coated, that would absorb slowly. Drugs that are lipid soluble are absorbed more rapidly. Changes in pH of the GI tract affect absorption time. Gastric emptying time, presence of food in the GI tract, all of these can affect how the drug is absorbed, as well as blood flow to the small intestine. So now that the drug has been administered and absorbed, it is now time for it to be distributed. Distribution is the movement of a drug into body fluids and tissue. So remember, absorption gets the drug into the circulatory system, but distribution gets the drug into body fluids and tissue. Distribution varies by the size of the drug molecule, drug affinity, tissue permeability, systemic circulation, protein binding, and pH. The distribution phase of pharmacokinetics is when we determine the steady state as well as the half-life of a drug. Half-life is the time it takes for the plasma concentration of a drug to decrease by 50% or 1/2. Half-life determines the time required to reach steady state and the dosage intended. Half-life is dependent on the clearance and distribution of the drug, not on its concentration or dosage. So the steady state is the concentration of a drug in the systemic circulation when the rate of the drug elimination equals the rate of drug availability. Steady state is usually reached after 4 to 5 half-lives. Okay, so let's discuss agonist and anti-agonist drugs. Agonist drugs combine with the receptor to stimulate a response. They induce a conformational change in the receptor that leads to a maximal effect. In other words, they activate the receptor. Examples of agonist drugs would be insulin and morphine. So what are antagonists? Obviously they would be the opposite. An antagonist drug interferes with receptor activity, or it inhibits the action of an agonist when bound to the receptor. Antagonist drugs do not activate the receptor when they are bound to it. Although antagonist drugs do not initiate a response, they prevent activation of the receptor. Examples would be antihistamines and Narcan. After the drug has been distributed, it now needs to be metabolized. Metabolism is the chemical conversion of a drug to a metabolite. It occurs by enzymes primarily in the liver. Other sites of metabolism include the kidneys or the renal system, the lungs, the small intestine, and the skin. Metabolism is broken down into 2 phases. In phase 1, the cells are broken down through oxidation, reduction, and hydrolysis, resulting in a loss of pharmacologic activity. The enzyme CYP450 is the enzyme responsible for the majority of most drug metabolism reactions. Remember that, enzyme CYP450. In phase 2, we have the conjugation reactions, and these reactions make drugs more water soluble for renal elimination. The last phase of the pharmacokinetics principle would be excretion. Excretion is the elimination of a drug from the body. So the elimination of a drug or its metabolite form from the body. The primary organ of excretion are the kidneys, but other routes of excretion include the lungs, saliva, sweat, feces, urine, and breast milk. Excreted drugs in breast milk have potential for unwanted pharmacologic effects in the nursing infant. Excretion of drugs into urine involves glomerular filtration, passive tubular reabsorption, and active tubular secretion. Most drugs enter the kidney tubule for excretion through active tubular secretion. Remember that fact. That fact has appeared on many tests. So once again, most drugs enter the kidney tubule for excretion through active tubular secretion. Okay, so that was a quick review of pharmacokinetics. Remember, a drug moves through the body via absorption, distribution, metabolism, and excretion. Now we are going to discuss pharmacodynamics. Pharmacodynamics is the study of how the body responds to the concentration of a drug and the biologic response that occurs. In this section, we will go over drug receptor interactions, dose-response relationships, and biochemical interactions. In drug receptor interactions, we are discussing how the drug reacts to the receptor. So a receptor is the protein in the cells that interact with a drug to produce a physiologic effect. Drug receptor interactions can either enhance or block. Drug receptor interactions can either enhance or block a drug's physiologic effect. In this picture here, we have a drug that's an antagonist. As we discussed earlier, or as you can see in this picture, the antagonist does not fit exactly with the receptor, so it will not activate that receptor. It is blocking the action. An example that we talked about earlier of an antagonist drug would be Narcan or antihistamines. The dose-response relationship looks at the concentration of the drug and the body's response. The minimum effective concentration is the lowest dose at which a desired response is noted. The maximum effect or the ceiling effect is the point at which no further physiologic response is achieved, regardless of an increase in the drug concentration. These next few slides are just going to be review and some key terms that you should know. Just take your time and go over them on your own. So I hope you were able to get a better understanding of some of the principles of pharmacology. Comments below if there's anything else you want me to go more in depth with, or if you have any questions. Thank you for bearing with me as we went through this. Pharmacology is not the most exciting to some, but we made it through the end of the slide. So thank you again. Don't forget to follow me on Instagram at iam.nursejackie, and also like, comment, and subscribe to my channel here.